The world we're living in right now is more toxic than ever. Chemicals, pollutants, pesticides. I mean, the food's no longer God-made food. We've got, microplastics. I mean, it has just got so much for us to deal with. It's literally impossible to keep a fully clean body with none of these things in it. And especially, it's important to keep your blood as clean as possible. So, I've been in a practice now for, my goodness, decades, and never had anything invasive in my clinic. And finally, just started to realize, we can't do much more than we're doing to detox. People are trying all these different detoxes and everything, and it's just hard. It's hard to get your body clean. So, this particular technology, I think you're going to really enjoy. You're going to see it live in action in this podcast we just did, and I think you're really going to love it. It's called EBOO, and we're the first clinic in Louisiana, Mississippi, or Arkansas. There's less than 100 clinics in the United States, and it's the original EBOO procedure that we brought to Louisiana. So I think you're really going to enjoy this. Stay tuned.
Hello, everyone. It's Cameron again. I'm here with Dr. Chris Cormier, and today I'm doing EBOO. Woo!
So, what is I guess for those out there, we're going to kind of do this in a podcast, almost look, but we wanted to show you what this procedure looks like and feels like for people out there. So, this is the first EBOO machine. We have two of them here in Louisiana. We're the only clinic that has them. We have a registered nurse that's here with us right now. She runs this whole thing for us. We have a medical doctor that runs it as well. And basically this is an amazing procedure that actually takes your blood out, goes through a filtration process, and it filters 60% of all the microbes, the heavy metals, the toxins, the microplastics, all the nasty stuff that we get in our blood over time. You can imagine it's a lot. So right now this blood's going out, getting filtered, and it's actually getting re-oxygenated and ozonated and put back in. You can see the color of it is obviously much different as it's coming out here to where it's going in there. So far, what does this feel like for you, Cameron?
Honestly, it's a really cool feeling. I do have to admit. So far, what I'm feeling is just like an overall, just relaxing feeling. I feel like coldness throughout my body, but not in a bad way. More of just like when your body calms down and everything just relaxes. That's mostly what I feel. Um, I think it's crazy to see some of the stuff that comes out of you, that's for sure. Seeing the difference in the color is, of course, awesome. Um, Miss Dodie, our nurse here, is absolutely amazing too. She's taking great care of me through this whole process. So I'm excited to see the end results and how I feel afterwards for sure.
Right. So most people don't realize this, but over time, we accumulate so much in our blood, and it's impossible. Like through just clothing that we're wearing, through the foods and drinks that we're drinking, through all the different things that we're breathing and rubbing against. I mean, you don't even know anymore like what's getting into your blood over time. But I will tell you, like 30 years ago, we didn't have near as much as we have now. So this procedure, we've been a non-invasive clinic now for 28 years, and I had to have something that's a major detox. So I consider this the ultimate detox for our human body. There's nothing like it. I did one yesterday, and I did a higher level, and this is a basic one called EBOO, but then there's an EBOO safe that's a bit more advanced, where it actually you can see all the trash that comes out in a container. And I had a container and a half of trash come out yesterday. Then one of the nurses here was telling me there's potential biofilms, all kinds of things that came out of me that was inside of me. So it's such a there were times I was literally falling asleep, and I'm not a needles person at all.
Me neither.
I don't like needles, but it's so relaxing. I can't really describe the feeling you get, and it's because you're taking all this toxic load and removing a significant portion from it, from her body, and then re-oxygenating and ozonating, putting that back in. We always talk about oxygen being a number one ingredient, right? So, what would you say for people out there maybe who don't know about what this is?
I would say because at first I was a little reluctant. I think something that you don't know is, of course, scary. But definitely research it and learn about it first. But the feeling that getting is something that feels so powerful in my body. There's no other way to describe that. Like I literally feel like I can feel this nasty stuff coming out of me and I can feel this good stuff going inside of me. So if that is something you want, why not give it a try? Um, I just think that I think people are nervous of stuff that they don't know of, and that's okay. But research it, learn about it, call us. We can give you the information that you need, and give it a go.
This procedure didn't just start yesterday
Yes.
for people out there. It's been around since 2000, the year 2000. It started with a family in Malaysia, and they have done serious homework in those 26 years on making this the best therapy out there for ultimate, really the ultimate detox for your body. And so thousands and thousands and thousands of people have undergone this procedure. This didn't just start yesterday, and there's about 100 plus clinics in the United States right now currently doing this. There are clinics all over the world that have EBOO. There are some bad EBOOs, and I don't mean that in a bad way. I just mean they're knockoff technologies that are out there where people try to copy their technology. This is actually the original, and in my opinion, it's the best. So when we're obviously here at the Nerve Health Institute, we try to give our patients the best of the best of the best. So, what else? I see something else on your mind, Cameron. What you got?
I'm tired. It definitely makes you feel like it's time for a little bit of a nap, but that's okay. I think that's what your body does in a big detox. You know, you start to calm down. You start to finally get to feel like you can relax. And as a mom of two, I never feel like that. So thank you, Ebu.
And also, some people going through this, we've seen it where people, as soon as they get this blood to start circulating and the fresh blood coming back in, they get emotional, because these emotional wounds sometimes in the body don't ever have the time to heal. But when you change your life, your blood, your life force is your blood. When you rejuvenate that blood in your body starts to self heal. And we talk about self healing all the time.
Yes, we do.
You were with me this morning. We asked the patient in the room what self healing is, and I mean, what's the look we get when we say what's self healing?
A very confused look because I mean you don't it's sad but you don't know they don't know they brainwash people to not believe that that's the case, but it is, and I can truly feel myself healing coming back. Like I feel like, you know me, I usually have some tummy aches, some aches and pains. Even just laying down like this, my stomach would always hurt, my back would hurt. I feel nothing right now. Like I literally feel like a ball of air right now.
Amazing.
Yes, really is.
So again, this procedure is in my opinion the ultimate detox, and it's something that everybody should have. There are some contraindications where, let's say you have lymph nodes removed, you can't have it done, and there's some other contraindications. Let's say you just had a stroke or a heart attack. There's some contraindications, but as far as that, there's a few other ones, but not as many as you would think. And the majority of people can do this procedure, but we have a nurse to be able to qualify, and a medical doctor to make sure that that's as high level qualified as possible. And this procedure, like I said, is life changing for people. So one of these EBOO procedures takes about an hour, and this does about a third of her blood in one procedure. So people can come and get multiple ones. And then once you have one, people always ask us, like, when do I need another one? When do I come back? And it's really up to you. Like, in terms, some people will just have one a year. I mean, you can imagine just having some sort of cleanup in your body and your blood is such a necessary thing. And so whatever people can afford is really what we have. So, and we also are working on packages right now to lessen and get people discounts for this procedure. So I guess, is there anything else you want to tell the world out there?
Come get your EBOO done here at the Nerve Health Institute.
Awesome. Thanks so much for listening.
If this podcast spoke to you, or if you feel like you have family members or friends that have these types of conditions that could benefit from this particular technology, then all you need to do is become a Body Chargers member or tell them about Body Chargers. Remember, it's our community that I created to help people at home with the best technologies in the world to be able to help you to self-heal your body at home and maximize your self-healing. So go to Body Chargers, become a member. That's the easiest way to get this done. And we look forward to serving you and your family. Also, if you want a higher level of care, we have the Nerve Health Institute you can always come to. That's our clinic where we have higher level services here to be able to help you. So I hope you enjoy, and we look forward to serving you and your family, and look forward to our next podcast.